In this video, we're going to talk about a variety of anxiety disorders, including generalized anxiety disorder, panic disorder, specific phobias, and obsessive-compulsive disorder. But before we do, let's have a couple of general notes about the difference between anxiety and an anxiety disorder, and let's just talk generally about anxiety disorders. So first of all, what is anxiety? Well, there's all sorts of different kinds of anxiety. For example, cognitive anxiety, which is worrying, anxious apprehension. There's also somatic anxiety. Soma, this term you might remember from the cell body. So soma means body. And so somatic anxiety is anxious physiological arousal. If you've ever been really anxious or really nervous, you might feel it in your body, like getting butterflies in your stomach. Note that at moderate amounts, anxiety is not only normal, but also adaptive and useful. For example, anxiety motivates us to study for a big test, to show up to work on time, or to avoid getting too close to the edge of a dangerous cliff. Anxiety becomes a problem, however, when it impacts a person's ability to function. When the anxiety becomes paralyzing or is otherwise disproportionately severe relative to the perceived threat, then we call it disordered. So what is an anxiety disorder? It's anxiety that is long-lasting and disruptive to everyday functioning. And you'll see these two components, the duration and the disruption, in all of the definitions for the various anxiety disorders we're going to discuss. So anxiety disorders are characterized by excessive and persistent fear and anxiety and by related disturbances in behavior. Taken together, anxiety disorders are among the most common psychological disorders with a lifetime prevalence of about 25 to 30%. 25 to 30% of people will get an anxiety disorder. They'll meet the criteria for an anxiety disorder at some point in their lives. And continuing to speak about this category of disorders generally, I'll also note that there's a significant gender difference in the prevalence of anxiety disorders. For example, it's estimated that about 23% of women, but only 14% of men, will experience at least one anxiety disorder within a 12-month period. Now let's talk about a few specific anxiety disorders, starting with generalized anxiety disorder, or GAD. So GAD is excessive and long-lasting. There's that duration, has to be at least 6 months. Excessive and long-lasting anxiety that is free-floating or otherwise unjustified. Free-floating anxiety is a term coined by Sigmund Freud, which refers to diffuse anxiety that isn't really focused on any specific object or situation. This is why we call it generalized. Generalized anxiety disorder must be accompanied by at least 3 of this list of symptoms you see here: restlessness, difficulty concentrating, being easily fatigued, muscle tension, so again, physiological components, irritability, and sleep difficulties. And the lifetime prevalence of generalized anxiety disorder is estimated to be about 5.7%. And again, a gender difference. It's about twice as common in women as compared to men. GAD is highly comorbid with mood disorders and other anxiety disorders, and it tends to be pretty chronic. There's also evidence to suggest that GAD increases risk for heart attacks and strokes, particularly for people with a history of heart conditions already. Let's talk for a moment now about panic disorder, or PD. Panic disorder is a pattern of recurrent, unexpected panic attacks. We're going to come back to that unexpected piece in a moment. And at least 1 month of concern over the possibility of having another panic attack. And I'll define panic attack as well here. It's a period of extreme fear or discomfort that develops abruptly and reaches its peak typically in about 10 minutes. And the symptoms of a panic attack can include accelerated heart rate, sweating, trembling, choking sensations, hot flashes or chills, dizziness or lightheadedness, fears of losing control or going crazy, or even the fear that you're dying. So having a panic attack is a very intense experience. Now note that, again, that unexpected piece. Expected panic attacks can happen as well. For example, when a person with a fear of public speaking has to give a big presentation. That's not surprising if that person then has a panic attack when he gets up to speak. According to the DSM, the Diagnostic and Statistical Manual of Mental Disorders, however, a diagnosis of panic disorder requires that the panic attacks be unexpected. For example, they can happen even while you're relaxing at home. And again, fears over the possibility of having another panic attack. This is very characteristic of panic disorder. And they're often paired, these fears of having another panic attack are often paired with self-defeating behaviors that are also characteristic of panic disorder. For example, a person whose panic attacks originated while working out at the gym may avoid exercise altogether. In this way, panic disorder has been characterized in the past simply as a fear of fear. Relatedly, let's talk about specific phobias, which are intense and persistent fears, again, intense and persistent duration, fears of an object or situation that are greatly out of proportion to the actual threat. And the lifetime prevalence of specific phobias is about 12.5%, meaning this is a very common psychological disorder, and there are all sorts of specific phobias that people have. For example, I'll start with a few common ones that you may have heard of. Acrophobia is a fear of heights. Think acrobat, right? Aerophobia is related, but it's a little different, a fear of flying. And arachnophobia, a fear of spiders. Apologies if you're watching this video and you have arachnophobia. I put a spider on the slide. Again, apologies. Probably not the best decision there. And there are all sorts of other specific phobias as well. This list is by no means all-inclusive. Now, there's one specific phobia that is listed in the DSM as a separate disorder entirely, agoraphobia. And I want to mention that real quick because it's commonly misunderstood. Agoraphobia is characterized by an intense anxiety and an avoidance of situations in which it would be difficult to get help or to escape if you experience a panic attack. For example, being in a really dense crowd or using public transportation. The lifetime prevalence of agoraphobia is estimated to be about 1.4%, so it's a little rarer, but not as rare as you might think. Let's talk now about social anxiety disorder. I mentioned it right after specific phobias, because it was formerly called a social phobia, but it was eventually changed to be called social anxiety disorder. But you're going to see some related things here. Social anxiety disorder is extreme and persistent fear. Again, we keep seeing this, extreme and persistent. It's not just your everyday anxiety or nervousness about social situations. It's extreme and persistent fear or anxiety and the avoidance of social situations in which a person could be negatively evaluated by others. So it's perfectly normal. Once again, I just really want to emphasize, it's perfectly normal to be nervous before a big presentation. But if your fears are significant enough, such that you don't even show up for the presentation, for example, then the anxiety is getting in the way of your ability to function, and we may call it disordered. The lifetime prevalence of social anxiety disorder is estimated to be about 12%, which means it's very common. And social anxiety disorders are associated with decreased educational attainment, lower salaries, and a greater prevalence of substance use problems. Last but not least, let's talk about Obsessive-Compulsive Disorder, or OCD. OCD is a cycle of thoughts and urges that are intrusive and unwanted that typically prompt the need to engage in repetitive behaviors or mental acts. So you see these terms here, obsessions and compulsions. Obsessions are those recurrent, intrusive thoughts or images that generate significant distress. For example, germs or contamination, feeling like your hands are dirty. This is an obsession. Harming the self or others. This is an urge. Or the need for symmetry. Compulsions, in contrast, are repetitive behaviors. So obsessions are thoughts or images. Compulsions are behaviors. So compulsions are repetitive behaviors aimed at reducing or preventing distress. For example, if you have a fear of contamination and that's your obsession, you may have a compulsion to clean, to wash your hands repeatedly, or to check, or to arrange, or to repeat something, or to count things. These are all common compulsions. And typically the person with OCD understands that their obsessions are irrational and tries to suppress them, but has great difficulty doing so, which encourages these repetitive and ritualistic compulsive acts that at least temporarily curb this anxiety. So the cycle is something like this. We have an obsession. This obsession leads to anxiety. Because of this anxiety, we engage in this compulsion, this behavior. That compulsion does provide a bit of relief, but that relief is temporary because ultimately those obsessions come back. Okay, now let's talk a little bit about the etiology, or the causes of anxiety disorders. Where do they come from? How do they develop? So first we have learning. Learning here is a very general term, but it could refer to anything from being classically conditioned to fear a previously neutral stimulus, to observational learning. For example, a child who sees their parents react with fear in response to a spider may sort of learn that spiders are dangerous and should be feared. And this could lead to the development of something like arachnophobia. There's also a host of dysfunctional cognitive processes that lead to the development of anxiety disorders. I'll go over a couple of quick examples. One is catastrophizing, this cognitive process in which we catastrophize. We see minor problems as much bigger than they actually are. We see them as catastrophes. Also, rumination, thinking about a problem over and over and over again until it drives you crazy. And finally, anxiety sensitivity. We've seen a little bit of this in our discussion of panic attacks and panic disorder, but this is a more general term, a fear of anxiety-related sensations. And finally, genes play a role too, to varying degrees depending on the specific anxiety disorder. The heritability of panic disorder, for example, is estimated to be about 43% approximately, suggesting that genetics play at least a moderate role in its development.